Hello everyone. Among numerous COVID-19 variants, recently Omicron variant pop out, making each one of us to rethink before leaving the house. India's Omicron tally has leveled up to number 23, despite Delta variant is still prevalent. But why? We all are taking the preventive measures against COVID-19. We all have been vaccinated even, at least with the single dose. But then why it is that this virus makes a comeback every time persistently, just like a movie sequel? How contagious is this virus? And can the vaccines which we have taken provide us immunity against it? Let's catch up all this information in this video. The answer to the virus comeback is mutation. Mutation in Hindi means parivartan and is a natural process. All the living organisms, including human beings, change over time to better fit in their environment, following Darwin's theory of survival of the fittest. Even the commonly known viruses like influenza virus, tuberculosis bacteria, they also change over time, and that's why their vaccines are needed to be updated regularly. The Wuhan strain of SARS-CoV-2 mutated over time and gave alpha, beta, gamma, delta, and now it's Omicron variant. Omicron variant, first identified in South Africa, has 32 mutations in its spike protein and 10 in its receptor, which make it different from the Delta variant. Delta had 13 mutations, and yet its transmissibility was quite high that even till date 90% of COVID cases are accounted for it. These mutations defines the severity of the variant, which can be assessed in three properties: the transmissibility, how fast it can spread; its infectivity or virulence, that means how fast it can infect the body; and third is the effectiveness of the public measures or the social measures, for example the vaccines or drugs on the variant. Depending on the severity, WHO has classified Omicron as variant of concern on November 26, 2021. So now let's discuss how contagious is this variant. WHO has reported that it would take weeks to exactly determine the infectivity, severity, and the effectiveness of the treatments or the vaccines on this variant. But yes, its transmissibility is quite high that it has affected 38 countries around the globe, though no deaths has been reported yet. One of the peer-reviewed health science journal in medicine reported that rate of infection of Omicron is 100 folds more than Delta variant. Also, it may have the potential to cause secondary infection just like the Delta variant. We all remember that last year there was a wave of black fungus in the COVID-19 patients. It was all due to Delta variant. This time we could expect that there may be the wave of the bacterial infections. Focusing on children, it may be too early to state or comment anything regarding it. However, South African doctors had seen a spike in the hospital admission of the children under 5. Also, WHO has showed concern to the children who are not vaccinated and said that they are at high risk. Coming up to the most important topic, whether the vaccines which we have taken provide us immunity against the variant. Omicron's swift rise in South Africa and all over the world definitely shows that it has the capacity to evade the immunity. Also, Paul Benias and his team from US, they conducted an experiment on bioengineered virus having similar mutations just like Omicron, and they found that it has the capacity to invade the immune system of the individuals who had recovered from the COVID-19 or who have been vaccinated. However, one of the famous pharmaceutical company GlaxoSmithKline stated that their drug sotrovimab worked against Omicron resembled bioengineered viruses. Also, K. Srinath Reddy, who is president of Public Health Foundation of India, stated that Covaxin may provide a better defense against Omicron variant. Talking about the booster doses of the vaccine, it's not yet clear how effective they will be against Omicron variant, but yes, it's likely that it may provide bulwark against the evading property of Omicron variant. So here comes the take-home message: vaccinate yourself and the people around you. because not only these unvaccinated people are vulnerable to the infection and hospitalization, but also they are the most fertile source for COVID-19 variants regeneration. Thus, a combination approach where the public health measures and vaccination can help us together to defeat COVID-19. Thank you so much for watching this video. If you like the content, do like, share and subscribe to this channel. Thank you.